the big report we are looking at in terms of the link between air pollution and COVID, air pollution being linked with higher COVID death rates. A Harvard University study says a small increase in long-term exposure to PM 2.5, that's the smallest particle which can cause a great deal of harm, leads to a large increase in COVID-19 death rates. The increase of 1 unit in PM 2.5 is associated with an 8% increase in the COVID death rate. It's important to continue enforcing existing air pollution regulations, is what Harvard says. Now, this in fact isn't rocket science. It's been said by some of India's leading doctors. For example, Dr. Randeep Guleria, the director of the All India Institute, has said air pollution will lead to an increase in the number of cases. Their data, based on modeling and observational data from Italy and China, seems to back this. Studies suggest even a 1-point rise in PM 2.5 can lead to a 6 to 9% rise in COVID cases. Both pollution and winter combined can lead to a spike in the number of COVID cases. Those who have a higher risk need to be very vigilant. A higher risk for people need to avoid areas where air quality is poor. Those in worse air quality areas are more vulnerable. Joining us now, Dr. Arvind Kumar, the founder of the Lung Care Foundation. Thank you, sir, very much for being with us. Chandra Bhushan, CEO of International Forum for Environment, Sustainability and Technology, with us, and the senior Aam Aadmi Party leader, Raghav Chadha, with us as well. Dr. Kumar, the Harvard findings are in fact very similar to what doctors around the world have been talking about. They seem to have data which suggests that it's common sense. More pollution, more vulnerable people, more vulnerability, the greater the chance of COVID. Are you already in your practice seeing evidence of this?
Vishnu, thank you very much for having me on this show. So data concerning the incidence of COVID with relation to pollution, as well as the mortality due to COVID with relation to pollution, has been emerging for last many months.
Yes.
The first report, in fact, had come from China, and then there was reports from Italy. There were reports from England and France combined study, and in between had come this Harvard study. The other studies have related to the incidence of COVID in pollution affected communities, whereas the Harvard study has specifically looked at the mortality in the COVID affected patients, relating it to PM 2.5. And as you very rightly mentioned, they found that even 1 microgram per meter cube increase in the long-term exposure to PM 2.5 was related to 8% increase in mortality, and this was across 300 different counties across USA. So it was not that it was confined to one city. So this is a very solid evidence which we already knew, but now it's in the form of a hard data that pollution in fact affected communities have two things. One, they have a higher chance of getting COVID compared to people living in less polluted areas. And two, if they get COVID, they are likely to have a higher mortality compared to their counterparts. Now, this has huge significance for us because we are now approaching a season where there is always every year a rise in the pollution levels to very high levels, and combined with the fact that we also have festival season coming, combined with the fact that there could be complacency on the part of people because of reported decrease in the incidence of COVID cases in the last 3 weeks. So these 2-3 things together could possibly lead to complacency on the part of people and leading to a spike in the number of cases.
Raghav,
and we need to be vigilant about it.
Raghav, you've heard Dr. Arvind Kumar speak. You've, we mentioned the Harvard report as well. Is this a big worry for you now in Delhi that, you are dealing politically with the problem of stubble burning? Then, of course, there's a very real non-political issue of COVID deaths and COVID cases. And now there's this new factor, and that millions in Delhi and indeed across North India could be worse affected. How would you react to what doctors are saying, what Harvard is saying?
Look, quite frankly, Vishnu, everyone, all of us knew that by the mere application of one's common sense, that both COVID-19 as well as rising levels of air pollution impact the respiratory health of an individual. And this time, of course, we have this raging pandemic which make matters worse. And therefore, as all doctors in the country have been highlighting, how this lethal cocktail of COVID-19 and air pollution can actually be very, very detrimental, perhaps even fatal in many cases. And what Harvard has suggested in its report, which essentially says that 1% increase in 2.5 levels can lead to 6 to 9% increase in the mortality rate. I mean, that is a very, very frightening figure. And the government of Delhi, Vishnu, is absolutely cognizant of it. And therefore, we are doing what we can as far as controlling the pandemic is concerned, as well as the levels of air pollution. Now, the infection rate in Delhi, let me first address with the issue of COVID-19, and then I'll speak on air pollution. The World Health Organization suggested that in order to consider COVID-19 outbreak to be under control, you need to have an infection rate of 5% for a period of 14 days. The government of Delhi, along with the people of Delhi, has worked very hard to bring down the infection rate. And the infection rate now, Vishnu, has been, shifting between 4% to 8%.
But cases have been going up, no, in the last few days, 4,000 plus?
Well, I am speaking in percentage because the number of tests have also increased, and therefore there is, of course, a proportionate increase in the number of reported cases. And therefore, I say that the infection rate is ranging between 4% to 8%, we're almost close to the WHO norm of, being in a position to say that at this point in time, at this very moment, COVID-19 outbreak in the city of Delhi seems to be under control. And we as a government are well equipped to deal in terms of our public health machinery to deal with this outbreak. However, to make matters worse, there is an issue of air pollution. And Vishnu, I have no qualms in saying this, that while the government of Delhi is doing all it can and perhaps will be doing more, air pollution is not a Delhi issue. Air pollution is a North India issue. And therefore, we need a North India solution. The government of Delhi, and we have been debating on your channel year after year.
And in fact, Arvind Kejriwal spoke about the need for various state governments to come together. But I wanted to go across to Chandra Bhushan. Sir, the fact is today there's been an important development in the Supreme Court with the centre saying that they'll come out with new laws specifically targeting stubble burning. Do you welcome this?
Vishnu, I'm not sure about what that law will be, because there's already a law which penalizes stubble burning. Stubble burning is illegal. In Punjab and Haryana, cases are being filed against farmers for burning stubble. Fines are being imposed on farmers as well. So I'm not sure how different this law will be from what exists right now. Maybe the amount of penalty is going to be increased. We'll have to see what framing the central government is coming up with. But I must say something, that I don't think that coercive action is going to deter farmers from burning stubble. My experience of traveling across Haryana and Punjab is that actually farmers are becoming quite angry about this law which is criminalizing stubble burning. There is almost like a civil disobedience that farmers are actually displaying right now. Some of them are saying that Supreme Court agreed to pay 2,500 rupees per acre. You have not paid that, therefore we are burning it. So I think we have to see what is going to work. I don't think that a coercive law is going to stop stubble burning. We need economic and technological solutions which will help farmers to dispose stubble properly.
Absolutely.
Raghav, go ahead briefly. Yes.
Yes, I think I completely agree with what the previous speaker has said. We do not need, we certainly do not need to disincentivize or penalize the burning of stubble. We need to incentivize the non-burning of stubble, and that is what governments need to do. As the previous speaker rightly pointed out, what the need of the hour is innovative technological interventions. In Delhi, Vishnu, you know this very well, that we have found an innovative solution called the Pusa biodecomposer. It's a liquid that is being sprayed in farmlands in Delhi, and farmers are extremely happy because they will get rid of the stubble. The soil will become more fertile for their next crop. And the government is doing this free of cost. Why can't Haryana, Punjab and UP government find similar technological interventions? We should not penalize the farmer for burning the stubble. If you give him money, if you incentivize the non-burning, give him happy cedar, give him, as a low-hanging fruit, just start buying the stubble from the farmer at the rate of 100 rupees per quintal, which the farmer associations across the country have been suggesting. Or change the crop cycle. Instead of producing rice, the government can legislate and say one can produce. I mean, there are hundreds and hundreds of solutions that one can come out with. But unfortunately, what we see is that Punjab and Haryana governments are completely apathetic towards the issue of air pollution. Air pollution does not exist in their scheme of things as an issue. And I think, to my mind, until air pollution becomes a political issue, until votes are won and lost, elections are won and lost on the issue of air pollution, these governments of Punjab and Haryana will not wake up.
Okay, well, we don't have a representative of the Haryana and or Punjab or UP government on this program. They would differ quite a lot. But unfortunately, it is a political issue.
I want to add something.
Yeah, go ahead, Mr. Chandrabhushan. Very briefly, I wanted to ask my last question to Dr. Kumar. Yeah.
Yes, I just want to say that it is a little more complicated than what Mr. Chadda has made it out to be. Decomposer is not the only thing that Delhi is doing. I think others are also trying it. Burning is a little more complicated than just the attitude of the government or the attitude of the farmer. It has to do with land holding. It has to do with kind of crop they are growing and what technology they are using. So I agree. I don't think we need to simplify it just as a political issue.
Okay, one final question to Dr. Arvind Kumar. My first question to you, sir, in the last few days, since we've seen the spike in air pollution in Delhi, are you seeing a rise in the number of patients who come in, patients who are more vulnerable, already affected by the symptoms of air pollution and therefore potentially more vulnerable to COVID?
Vishnu, it will be too premature for me to be saying it because the pollution levels have just started rising. Till about 10 days back, we were saying a continuous increase in the number of COVID cases, which was happening for the last 6-8 weeks or so. So it's difficult to say whether that increase which was happening had any correlation with the pollution. And now, last few days, we've seen a decline in numbers, although the pollution levels are rising. So I think it will be too premature for me to report on a definite observed correlation between these two events. We just need to wait for some more time and more data to collect.
I'd like to thank all of you very much for joining us. The issue of COVID-19 and air pollution, it is a real hammer upon us. Will something be done to deal with this? Air pollution needs to be tackled. We've been seeing it year after year. Thank you all very much for being with us.